Okay, welcome everybody. Thank you for joining us. My name is Jesse Colbeck. I am an operations manager in the Interior Health, and I'm based in the beautiful Salix territory, which is now known as Penticton. I was super excited to hear that this is the highest attendance concurrent session, and the fact that so many of us are keen to learn about collaborative goal setting is pretty typical of renal clinicians always looking to raise the bar. Our session today makes me reflect on myself as a young clinician. I'm a dietitian by trade and had the pleasure of working in the IH Renal program for 13 years as a dietitian before I moved into operations. As a young, cleaned clinician, Fred came into my office one day with a high potassium. Armed with my lovely handout and polished spiel, success was imminent. I'd explain it, and Fred would never have high potassium again. A month later, Fred had high potassium again. I asked myself, why didn't Fred do what I said? And there began my ongoing journey. I knew I had to better understand Fred and that I had to change my methods if I wanted to be an impactful clinician. I am super excited to be introducing an amazing panel of speakers here today. Paul Watson is a Pulitzer Prize-winning journalist and best-selling author of 3 books. He has stage 4 polycystic kidney disease and has served in a number of patient partner roles with BC Renal and other organizations, such as the PKD Foundation of Canada. Catching up. Helen Chiu has 15 plus years of experience in healthcare and research networks. With expertise in knowledge translation and quality improvement, she joined BC Renal in 2013. Helen now serves as a quality lead, driving and supporting improvement initiatives in the provincial kidney network. She is passionate about collaborating to advance person-centered care. Dara Lewis has been a registered nurse with Vancouver Coastal Health for the last 20 years and works as an educator with the Regional Palliative Approach to Care Education team. She is a strong advocate for person-centered care and feels that this is best achieved when interdisciplinary teams support patients to explore and express their understanding of their illness and their priorities and wishes for their health. Dr. Nadia Zalunardo is a clinical associate professor of medicine with UBC and a nephrologist at VGH within Vancouver Coastal Health. Her clinical practice spans the spectrum of kidney care, from acute kidney injury to director of the kidney care clinic at VGH. And Janice Rotinsky, jumped ahead there, has been nursing since 1994 and spent most of her nursing journey in emergency departments, both in Vancouver and the Middle East. She has been a renal program manager for the past 6 years and is constantly amazed at the complexities of kidney disease. Francine Gosselin is a registered social worker and professional life coach with experience working in kidney care, home dialysis, and post-transplant clinics. We got to hear from her this morning already when we learned about how awesome the Kidney Hub is. More recently, she's the kidney wellness coach for the Hub, and Francine is passionate about having patient voices be at the center of their care and believes that this is possible if we just slow down and listen. So with that, I welcome Paul to the podium. And by the way, we have no disclosures.
Thank you. Enough about kidneys. Let's talk about sailing. And fair warning, I get emotional about sailing, so if I have to pause from time to time, don't worry, it'll pass. There's a magic moment in sailing. Your boat is pointed head to wind. The mainsail is freshly hoisted and it's luffing. And the lines are flailing and flogging against open air. And then the skipper turns the boat away, and suddenly that big sail billows out, and suddenly it snaps taut, and the sound is crisp. To me, it sounds like when I was a kid, and I used to hear starched linen fluttering on the breeze. It's a snap. And I live for that sound. It sets me free. It sets me free that from all that's wrong in the world. It's like a spiritual experience. So when someone asks me, as my kidney function is declining and I slip closer to end stage, what matters most to you, I don't have to think about it. The answer is constantly on my lips. I want to sail. I need to keep sailing. Now, in a group of people who are experts in kidney disease, that may sound trivial, but I hope when I'm finished, you'll see that if you want to understand me as a patient, you need to know that, because everything that I think about in the day, it's not my kidneys, it's how do I get back out on that boat? I inherited polycystic kidney disease from my father. He died from it, or from complications of it, when I was only 2 years old. I've known my turn was coming for a long time, but naturally I didn't really give the inevitable much thought. Now it's becoming too real to shrug off. My kidneys are roughly the size of footballs. Now, when I tell people that, they think, how is that possible? Well, if I step out, you'll see. It's pretty much like being pregnant with twins in the end of the first trimester, but I'm not built for it. So my kidneys press against muscle and bone and other organs, and even light exercise can set off excruciating pain. My estimated GFR is down to 22, not so bad, but for one reason or another, I'm tired all the time. I know we're all tired. You guys work extraordinary hours, but I haven't always felt this tired, so it's difficult to live with. Comorbidities, a growing list of them, are taking their toll. At the current rate of decline, it seems I have a couple of years left before end stage, if I can't find a donor in time. And if that happens, then dialysis is my only hope. Faced with those facts, I imagine a lot of people would answer the question, what is your main goal? With, I want to live longer. In a poll, I doubt the answer, I want to sail more, would rank very high. But every patient is a person who sees life differently. More pills or higher doses might lower my blood pressure enough to squeeze a little more life out of my kidneys or reduce the risk of a heart attack or stroke. But experience tells me they'll also feed my fatigue. My choice in the matter is clear. I don't want to spend more time in bed or stretched out on the couch. I want to be in a boat, riding, I want to be in a boat, riding wind on water until my body won't let me anymore. So I spend a lot of time thinking about and researching practical matters. One may sound unrealistic, even trivial, but solving it is crucial to me. Will home dialysis equipment work on an anchored sailboat under battery power? Would a solar-powered generator be strong enough? Figuring that out will determine whether I can continue to cruise on keelboats. But I'm also a dinghy sailor. That's my boat, I think. Do you see a boat? That's my boat. And you can tell I love her. She's a handful sometimes. That's the beach at Jericho where I have to launch her. So I've got to go into the water to do it. It's waist high. So if I have an opening for a catheter, let's say I'm on home dialysis, is that going to be a problem? Will I get infection? Will a nurse even allow me to do it? It's also the sort of boat that tends to capsize a lot, so I fall in the water. Will that be another risk of infection? Beyond those and other practical questions that stem from goal setting, there is the issue of psychological impact. Simply put, achieving my central goal and continuing to sail will keep me motivated to keep my health better so I can sail more. It's a circle. I fear that failure on that front could exacerbate depression. I don't like to admit it, but for all sorts of reasons, I'm prone to depression, and the kidney disease, as it progresses, simply makes it worse. During a recent hospital stay, I learned something important from a resident physician. He told me his medical school stressed that physicians should treat the patient, not the numbers. Understanding what really matters to the patient must be central to that philosophy. Living longer, no matter the circumstances, is not everyone's goal. I accept that someday I must die. Sadly, everyone in this room must. So I look at a life-threatening disease, one with no cure, this way. I want to live as many good days as I can. My biggest enemy is not my kidneys, not my heart, not the dissected aneurysm in my head. It is surrender. Understanding what drives me to win, that longing for wind and sea, can help the people working so hard to help me know if I'm giving up too soon. Now, before I go, I want to thank all of you for all that you do to help people like me stay alive longer and live a more complete life. I truly don't know how you do it, and I'm deeply grateful. Thank you.
Thank you, Paul, for that heartfelt story. I don't know how to follow after that, but the story is really grounding to how we understand patient goal setting from a patient perspective and why it matters so much in kidney care. I am here to give everyone more context related to the topic with an overview of the provincial strategy to advance collaborative patient goal setting across the spectrum of kidney care. Patient goal setting is a pivotal patient self-management component. It is a process of acquiring information for and studying of specific collaborative goals between the healthcare provider and the patient in managing chronic conditions. So the goals can be medically related, and it could also be, like Paul has alluded, non-medically related. It involves a series of iterative conversations focusing on what matters to the patient. Why we want to focus on this is that goal setting is identified as a key improvement priorities both in the 2016 and 2022 Provincial Patient Experience Survey. In fact, in follow-up to the 2016 survey result, we led a series of engagement activities to better understand this topic and actions that we could take as a community to improve patient goal setting. In 2019, we conducted a series of 7 focus groups across the province in all of the renal programs with the frontline clinicians, the managers, importantly, the patients and their caregivers to look at what is it that exists in the gaps. And thankfully, from the various groups, we were also able to generate ideas to help address those gaps related to having those important conversations. And then in February 2020, we come together in a provincial workshop of 42 participants of frontline clinicians, managers, patients, healthcare providers, also community partners like Kidney Foundation, to help build on the focus group findings and the environmental scan of resources and tools available out there to support goal setting. And so from there, we collectively discern a concrete way forward regarding the topic. It led to the development of this strategy, which is called Better Together, a strategy for collaborative, to advance collaborative patient goal setting in kidney care. This is a unique strategy in that it's very action-oriented. It's not meant to be set on the shelf. And it's just not prescriptive. So then the ideas that are described within the strategy can be readily adapted into various local kidney care settings. And I'm going to walk you through some of the components within the strategy. This is the framework within the strategy where it outlined the spirit or the attitude of motivational interviewing, and also outlined the processes of motivational interviewing, which is a conversation style that is a lot about listening and also strengthening a person's own motivations and commitment to change. And that's very important in terms of in terms of guiding those conversations with the patients and family along the journey. It comes with a toolbox that includes tools and resources that are readily available to BC clinicians to initiate those conversations and have those conversations on an ongoing basis. They include What Matters to You, Self-Management Program by Self-Management BC, the Brief Action Planning, Serious Illness Conversation Guide, which is often used in advanced care planning, My Symptom Checklist, also known as the ESAS, and the BC Renal Transition Guide. The improvement ideas that came from the focus group and also workshop, they are organized into 4 main categories. And the 4 categories acronym is PASS. It stands for partnership, which is about drawing on the collective wisdom of the patient, family, and healthcare provider to work together as a team. Awareness is about increasing awareness of goal setting and understanding what it is. Adaptability is about having a flexible process and safe space to have those important conversations. Finally, support is about having ongoing support for the patients and family along their journeys. And these improvement idea in those 4 categories is available on a fillable PDF worksheet, a copy of which is also available on the tables in the middle sections here in the ballroom. You can also download a copy of it on the BC Renal website under the self-management section. What is this? It's essentially a driver diagram. So you could start from the left by defining the aim of your improvement efforts, what you hope to accomplish related to patient goal setting, and then defining those key areas of actions that you want to improve or change for that project, and then brainstorm ideas that are more relevant to your local kidney care settings that you can test out systematically. So any individual clinical teams or community groups can make use of this with impact for better goal setting. And in terms of how we're doing right now, we look at the key questions, the 2 key questions pertaining to patient goal setting in the Provincial Patient Experience Survey. So these are 2 graphs that compare the 2016 result, the average score of those 2 questions, with the 2022 survey result in purple. And these are listed by modality of kidney care or different types of kidney care. So if you look across, we see that the results are comparable relating to the 2 questions. However, there seems to be a little bit of a step back in kidney care clinics and in-center hemodialysis related to asking patients to talk about their goals in caring for their condition. And this might be likely due to the COVID-19 pandemic when there are so many different competing priorities related to safety. However, we are seeing some promising signs that related to helping patients set specific goals in caring for their conditions is improving. In the 2022 Patient Experience Survey, we asked an optional open-ended question: what is the most important change we could make to improve patient experience with BC Kidney Services? And these are just a few quotes that are selected, shown on the slide, from patients that are related to patient goal setting. All that is to say that patient goal setting remains to be a top improvement priority in our BC community. And there are some early signs of improvement, especially around awareness. However, there is still a lot more that needs to be done. And there are, the good news is there are existing resources and tools available to clinical teams and community groups to help us get better together on that front. I would like to thank you all in the last several years for participating in the focus group, the workshop, and also taking the strategy back to their renal programs and do some improvement work around it. That is very important. And thank you all for your attention. I will pass on the mic to my colleagues who will share a couple of the projects that happen within the renal programs.
Thank you, Helen. My name is Dara Lewis. I am the project lead for the What Matters Conversation project in the Vancouver General Hospital Kidney Care Clinic. I want to challenge each of you for a moment. If you have a pen or pencil or iPhone with you, I want you to take a second to answer that question. What matters most to you? What makes a good day a good day? And then I want you to think about whether you can answer that question on behalf of the patients that you care for. Keep that in the back of your mind throughout the presentation. So this started at Vancouver Coastal Health many years ago with the recognition, like many health authorities, that goals of care conversations are important to patient care. Vancouver Coastal Health started an education team called RPACE, of which I am the Vancouver Acute lead, back in 2017. And after many years of providing education throughout the hospital, really sprinkling it here and there, we realized that education alone does not change practice. It's not enough. We also recognize that having an outside partner come in doesn't necessarily result in practice change, because people don't like outsiders coming in with change management ideas. And so we wanted to upstream these conversations with an embedded approach. We wanted to talk to patients earlier rather than later in their illness journeys. And so the Vancouver Kidney Care Clinic became the focus of my work for a 10-month period as a 0.8 FTE goals of care lead embedded within the program. And this was a collaborative project between the regional palliative program with VCH and the renal program. Our improvement aims were as follows. For one, we wanted to increase the engagement and the confidence levels of the staff members in having goals of care conversations. We also sought to increase the documentation of these conversations so that it could be shared within the team, but also that this information did not end with that visit, but rather carried across care settings to acute care and to other community providers. And last but definitely not least, for patients like Paul, we wanted to improve patients' perceptions that we really did care about their values and priorities, and that we were incorporating that into their care and enhancing their satisfaction with specifically tailored care. The context of the project was a multidisciplinary team of about 25 clinicians. The disciplines are listed there, caring for about 1,500 plus renal outpatients with a variety of different cultural backgrounds. This started with Dr. Zalunardo and I doing an environmental scan. Part of having a really effective goals of care conversation is making sure your patients and families understand their illness and understand what their options are. And so we went from having relatively blank walls in the exam rooms to selecting very specific and creating specific posters that would encourage patients and families to better understand their illness, to understand and feel empowered as to the choices, and I do say choices, that they have in managing their illness, and also motivate them to express their wishes and priorities in terms of healthcare and feel empowered to initiate those conversations with their care team and with their own families. Some of the other interventions that I did alongside a wonderful working group in the Kidney Care Clinic included providing education sessions of all shapes and sizes. Sometimes it was one-on-one education, sometimes it was webinars or group sessions. We also looked at very specific issues like conversation strategies to navigate some of the common challenges we were encountering, like patient or family hesitancy to come to an education session and learn about what their replacement therapy options were, which I can imagine, if you put yourself in the shoes of someone with kidney disease, can induce probably quite a bit of fear and uncover a new reality. I also put together new hire orientation modules that are available on Learning Hub to each and every one of the clinicians probably in this room, so that after I left the project, there was ongoing resources available for sustainability. But education, as I'd said before, was not enough. And so we looked at how we could embed prompts to these conversations and specific questions within the workflows and the forms within the clinic. And so each and every discipline had a prompt within their clinician assessment forms to initiate asking these questions. We also embedded them in the patient questionnaires that patients filled out in the waiting rooms, an opportunity that took none of us as clinicians taking more time in our day, but rather gave patients an open-ended voice to share with us what mattered to them and what was worrying or troubling them. And finally, by being an embedded lead on the unit, I was able to provide at-the-elbow support on an as-needed basis in patient visits, sometimes phone calls, those kidney replacement therapy sessions, and do some one-on-one debriefing with each member of the team to reflect on what went well and what we might try differently next time. On some of the closer tables, just as Helen had mentioned, there is a handout, an infographic that I created that's up there on the slide. I'm not gonna belabor this, but these are essentially some of the elements of what matters conversations or goals of care conversations that we included in the interventions. Some of the interventions were really specifically focused on those with a conservative care pathway, those not choosing to do dialysis or transplant. We worked with the working group to ensure that we were shifting the focus of our kidney replacement therapies to include conservative care as an option that we talked about with every single patient, regardless of clinician bias, regardless of the age of the client, that each and every one of them got the opportunity to hear about conservative care as an equally valid option in care alongside dialysis and transplant. We also recognized that this required us to enhance clinicians' comfort with how do I talk about conservative care? And how do I talk about it in a way that doesn't sound like we're not providing care or we're not intervening? And finally, Ina Zoria and I, the conservative care nurse, worked significantly in enhancing the partnerships between the Kidney Care Clinic at VGH and our community partners so that we were no longer working in silos, but rather working alongside one another to care for clients and patients that we shared in common. And so now there's a lot greater communication between the home health nursing teams, the long-term care teams, and the conservative care nurse at the Kidney Care Clinic, raising that awareness that one another existed. Some of the results before I turn it over to Nadia were obtained through patient and family surveys that we did pre and post, as well as clinician surveys done pre and post. Our external evaluator also interviewed 15 of the members of the multidisciplinary care team. From the patient family surveys, we found that they did in fact show improved understanding of their illness and their care options. They had that sense over time that we were paying attention more to what mattered to them, and this led to them having a greater satisfaction in their level of care. Clinicians also reported in 100% of surveyed physicians and 45% of staff an increased prioritization of goals of care, and an increased confidence in using goals of care strategies amongst 100% of the surveyed physicians and 66% of staff. And one of our last metrics just shows you the value of, again, coaching people to document goals of care conversations in a place where it values not only this current care team, but other care teams. So that just demonstrates the enhanced documentation that took place from the inception of the project through to the end of the project, and I'm happy to say that that has been a sustained improvement after I left. I'll hand it over to Nadia.
Thanks, Dara. I'm Nadia Zalunardo. I'm the medical director of the VGH Kidney Clinic. I'm here really to speak for the team to talk about, in the next couple of slides, just briefly, the main lessons we learned from the work that Dara worked with us on and the challenges that we faced during the project. So first, and probably the most important thing, is that ultimately this is a slight shift in the way we practice. And that change ultimately depends on having the staff being engaged in the process from the beginning and having dedicated time set for professional development. Second, the embedded presence of a goals of care lead did make a difference. I think these goals of care conversations can be somewhat uncomfortable or unfamiliar for people. And so having Dara there in the moment to coach and mentor was quite helpful for the team. Overall, and as Dara alluded to, the team members do feel more comfortable in engaging of goals of care conversations, and I think recognize the value of doing this earlier in the kidney disease trajectory, and in particular found that some of the practical tools that we developed were very useful. So for example, the embedded questions in the patient documentations that they fill out when they come to clinic, embedded trigger questions for clinicians when they're doing their assessments, and the What Matters Most worksheet, for example, that we incorporate into our assessments routinely. I would say, though, that there are still varying levels of comfort around goals of care conversations within our staff. And we now need to look towards developing a sustainment plan that meets people where they are at currently for our existing staff, and also supports people during their onboarding process to the kidney care clinic. Finally, the connections that we have with the community-based resources, including home health, but others as well, have been very valuable, not only for patient care, but I think given our team comfort that in particular for patients who are on a conservative care pathway, that they can be well supported within the community in partnership with community resources. So what about the challenges? Ultimately, we were challenged mostly by time in a couple of ways. The first is our project happened to coincide with the time where VGH implemented a new electronic medical record. So that was somewhat of a distraction for part of the project. And in addition, and like everywhere else, we have suffered from some staffing shortages as well. So that just resulted in the staff not necessarily being always able to focus on this work as much as they would have liked. Within the patient appointments, the staff consistently cite that there are time constraints where there are so many issues to address and not enough time to do. And I would say this is a particular concern voiced amongst the nursing staff that we still need to work on. And finally, there is some requirement now to document within 2 EMRs, and that does take time and ultimately, I think, does potentially increase the chances of missing opportunities to improve communication across care settings. So Dara and I would like to thank these partners in the project and to you for your attention. Thanks.
All right. So the project that we did in Island Health isn't quite as comprehensive as what you just heard. And we're still in process of trying to figure out and negotiate our project. So we decided that we would start at the very beginning. And a special thank you to BC Renal for giving us some extra funding in terms of project money, so we're able to dedicate staff and time to taking care of our patients and finding out what their goals are and supporting them in their journey. So some of the background was we decided to start at the very beginning with our patients. We do have a startup checklist for all of our patients coming in, which includes doing their blood work and education and everything that's involved in getting someone ready to transition in their renal disease from kidney care to hemodialysis in-center. So we have this huge, massive startup checklist, and we were finding that it just wasn't getting done. So one, we were greatly struggling with staffing. So the staff were super busy and trying to get everything done in terms of getting someone ready for hemodialysis. We were noticing that the startup checklists were taking months and months to complete. The staff were super frustrated because they had this long list of things to do with no time to do it, so they were rushing through things. Patients were unaware. We were finding patients weren't aware of the different options they had in terms of what different modalities are available to them, what different settings are available to them, for example, going to a community setting. We were just finding that once we approached them, they just wanted to stay in the in-center, and they were very resistant to moving. So that told us intuitively that patients weren't really aware of the different options available to them. And also that patients were they were starting their journey in hemodialysis, and which meant a progression in their kidney disease. So they were super stressed out and starting their education at a time when they're just entering a department that is super busy, all this machinery that's unfamiliar to them. The education just wasn't really sinking into them. It wasn't really the right time. But it was the right time for our staff in terms of where the checklist falls and giving them education and tours of the unit and what's happening with them. So we're finding that patients were super overwhelmed and they probably weren't really hearing what we were trying to tell them. And lastly, our care plans were empty. So we weren't getting the modality information passed on to different caregivers. The goals of care of the patients wasn't getting passed on. What matters to patients wasn't getting passed on to the next caregiver. So we were finding lots of issues. So we decided to put forward a project to BC Renal to try and address some of these issues so we could get better at our goals of care and finding out what matters to our patients. So we decided to support patients when they transition through the program, beginning when they first start dialysis. And what this really involved was just having a startup nurse. So we utilized our casual nurses to be a point person. So they worked really closely with our CNLs and our educators. First, our CNLs to find out which patients are coming, which patients are new. So what patients we're expecting from kidney care and what patients just landed on our doorstep. And it would start with just a simple phone call to the patient, ideally before they even hit the department, just to introduce themselves and say, hey, we know you're coming to the department. This is what you can bring. This is what you can expect. Do you have any questions? Just so they had some familiarity prior to coming. And then once they came, a perfect scenario would be that that nurse would care for the patient when they first came. That hasn't turned out to be the case thus far, but it hasn't really impacted our project too much. But we are doing a lot of follow-up so that nurse will come into the department and look at the checklist and see where we got with it. So to make sure that one, the stuff was getting done that needed to get done, that the blood work was entered, the blood work was done, all that kind of stuff that needed to be done based on their conversations and the conversation of the nurse with the primary nurse was starting to update the care plan to make sure that the care plan communicated with everybody what we already knew. So we were finding that those conversations were happening, but they weren't being documented. So we just made sure they were being well documented to pass on to other people. We made sure that we did follow up as well with the patients. So Follow-up, we did a very loose timeline of like 2 weeks, a few months, and then a few months after that. But it all depends on the patients. We're finding some patients need a follow-up really quickly because they're super anxious, and other patients couldn't be bothered with a follow-up right away, so we automatically schedule it at 2 weeks. And it's just a very simple phone call just to be like, oh, how are things? Do you have any questions? Let me tell you a little bit more. And also to ask those really important questions and start those conversations about goals of care, what matters to patients, and what they're really looking for in their experience in the unit. We're also looking at modality as well, so what their modality choices are. So we're also targeting patients not only new to hemodialysis, but also patients who are transitioning out of hemodialysis and going to either a different center. So they might be going to the in-center to the community or changing modalities, for example. So we're trying to capture those patients as well, that transition point in their journey. Those, we decided to test our assumptions. So our assumption was that things were going terribly. So we decided to really find out. So we decided to do a quick survey of all the patients who started in the hemodialysis unit, just very simply in 2023. We did a very quick survey with them, which I posted on the screen there. Just basically, what was your experience like? Do you have any feedback for us? And we had a very varied response. Some people had an amazing experience and other people didn't have a very good experience. So we're kind of hoping at the very end to repeat the survey that we have to get more people who are having a really good experience and feeling comfortable with their journey. We're also doing audits of our new patient startup packages as we progress through this project to see that there is some improvement in that startup package, whether it's done by the startup nurse or by our nurses that are working on the floor, as well as mentoring the staff that are on the floor. So having that startup nurse there to work with the primary nurse to mentor them on what a really good startup would look like for patients. And it also gives our nurses a little bit of breathing room to know that they're not the only one responsible for it. So knowing that if they're super busy and they just can't get to it, someone has their back to help them out a little bit in terms of making sure our patients are supported. One thing we do know is that all of our staff are really interested in their patients and what their journey is like and what matters to them, but they just don't have time to get that information or even document it. So having someone that has their back, even if they have that conversation with the startup nurse, to know that that information is passed on has made a huge difference. So we're in process right now of our project. So we're in process of doing the pre-hemodialysis check-ins, talking to our patients, following up with them as they come into the unit, following up with our nurses, looking at blood work, doing all the audits and all that type of stuff. So it's all happening as I speak right now. We're hoping through this whole project that it's going to tie into a whole bunch of stuff, particularly with improving our patient goal setting and looking at the survey results that BC Renal did, and looking at where we fall down and ensuring that our patients are well supported. I'm happy to say that the majority of our patients feel well supported when they're in our department, but there's the odd few that don't, and those are the people that we really want to capture. So we're really looking to find out what matters to our patients and have that shared understanding between patients and our staff so that when patients come, they don't feel that they're completely alone. We're hoping to target education with our patients a little bit more. So introducing the hub that we talked about a little bit earlier, introducing some community services that we have within Island Health that deals with chronic care, and doing all those different type of things so our patients are well educated in chronic disease management as well as their kidney disease itself. We're hoping to work with our staff to make more action plans in terms of what do our staff need and what do our patients need in terms of what do we need to provide for action and how do we do that. And most importantly, looking at their goals and what matters to our patients is first and foremost on our mind. I'd like to acknowledge our unit. The staff really work hard to make sure that our patients are feeling well supported. One of our educators, Elsa McNary, has been instrumental in getting this going and organizing. And of course, BC Renal has helped us in terms of our funding when it seems like there's no money, that we always can grab a little bit to make sure that we have staff to deal with such an important topic. And that's it.
All right, hello again. So in my work over the years, both as a social worker in healthcare and in my private practice as a life coach, I've come to recognize the power of voice and choice in people's experiences coping with health and personal challenges. What I've noticed is that if people are provided with sufficient information to understand the facts and enough support to process their experience as it evolves, that they are better able to engage with their care team. They're more actively involved with their treatments, and they report overall healthier and more positive care experiences. A big part of my job is to work with patients to process the hard stuff and to identify what's possible to help them feel better. This work entails getting to know what matters to them, understanding what patterns of thinking influence their experience, helping them let go of any unrealistic or unattainable expectations, creating goals that are realistic and attainable, creating action plans that are within their control, and listening to their values and their beliefs. This is collaborative goal setting. As you've already heard, collaborative goal setting has been identified as a priority at the provincial level, and there's already been some amazing initiatives in some of the units across the province to try and implement these changes. I'm also very aware that our system is strained and we're all pretty tapped out when it comes to what our capacity is. Many of us might think that having rich goal-setting conversations with our patients is just an unattainable task. And some of us might feel uncomfortable or untrained to have those difficult conversations around things like end-of-life care. We also might be a little bit fearful of the possibility that our patients may not want to hear what we have to say, or what if they actually do open up about how they're feeling and now we have to respond to emotions? Yet, we've heard here today that there are many benefits when we include patients' voices in care planning. Helen already mentioned some of the more polished tools that we have, and you've heard about the What Matters to You guides that are there that hopefully one day all the units can implement into their programs. But for me, I just wanted to share a few things, a few different strategies that you could implement into your practice, even walking out of here today, just at the personal level. And I challenge you to try and take one or two of these away. A quick note about capacity is just that for the sake of this presentation, I am assuming that the patients that we're talking about here are capable of understanding and making decisions. And a capable person does have the right to direct their own care, even if we don't like the choices they make. Capacity could be a whole other session. So here we go. Collaborative goal setting, first of all, recognizes the person in front of us as a unique individual. Our patient might be the 10th patient we've seen today, or the 400th person this year that we've seen with this condition, but each person is on their own unique journey. We need to focus on the person, not the diagnosis. Patients may be eager to meet with us, or they may be dreading the encounter. They may have been waiting months to see us, or it might feel like their kidney disease has come out of nowhere and hit them like a ton of bricks. They may be coping well, or they may be struggling. Either way, we are able to ease their experience, starting with how we enter the room. Before you enter into an engagement with a patient, just pause for 2 seconds and notice your energy. If you're feeling rushed or distracted, maybe you've just come from another difficult conversation or you've had a really busy morning, just take a breath before proceeding with this next patient. Start by introducing yourself and the purpose for your visit. Even if you've met the patient a dozen times and you believe the purpose of your visit to be pretty obvious, just take the time. I notice a big difference with how patients respond when I take a moment to check in first compared to if I just jump right into business. I could simply say, "Thanks for coming in today. How was the drive in?" Or if I know the patient a bit better, it could be, "Nice to see you, Gail. How's the family?" You could also ask, "Is there anything you need before we get started?" Connecting with our patients as individuals cannot be emphasized enough. It only takes a moment, and it can promote emotional safety, which helps our patients feel seen as more than just a task to be completed. Ask your patient if there's anyone else they would like to be part of the care planning or goal-setting conversations. Informal care partners are critical members of our patient's care team. We want to get consent every step of the way. Is it okay for me to come to your bedside right now? Do you mind if I check your blood pressure? Would it be okay if we spent some time discussing your care? And so on. It might feel excessive to ask for permission repeatedly, but the message this sends to our patients is that their voice matters and they are in control. Once we have our patients' consent to continue, we want to try and understand what they are hoping for. We can do this by simply getting curious and asking, "What are you hopeful for? What change would you like to see?" We can ask specific to an encounter, "Susan, before we start, what goals do you have for our time today? Or do you have any concerns that you hope I can address before you leave?" Or we can ask about goals related to the bigger picture of their life. What is most important to you when you think about the future? Or what would you like this treatment to give you or allow you to do? Use open-ended questions rather than closed ones. What questions do you have? Rather than, do you have any questions? As Paul described, patients are more than their diagnoses, and their goals may have nothing to do with their kidneys. Listen actively to what the patient is saying, and sometimes not saying. Then seek confirmation about what you think you heard. An easy way to check in is simply saying, "What I think I hear you saying is this. Am I getting it right?" Patients vary, and so do care providers. Every one of us has a unique set of values, expectations, cultural backgrounds, personal beliefs, and narratives that we bring to every encounter we have. The energy we bring also fluctuates and can be impacted by external factors, such as how busy we are and what's going on in our personal lives. Consider what it took for your patient to get to the meeting. Did they travel far? Was it hard to find parking? How are they feeling today? What worries, hopes, and goals do they have? Are they distracted by something completely unrelated to their situation, such as financial stress or a sick relative back home? Do they have any past trauma with the healthcare system or authority figures in general? What power dynamics exist between patient and provider, real or perceived? This is your patient's life, and they didn't choose to be here. In fact, they really don't want to be here. They don't want to be dealing with any of this. People living with kidney disease are just regular people, and each patient is an expert in their own life. Get curious and ask, beyond the medical, what would you like us, your care team, to know about your situation? As Paul mentioned, we will all die, but what makes our lives worth living is different for each of us. Once goals have been established and an action plan defined, it's valuable if we can create a process to evaluate and revise how things are going. If a specific action is not happening, what needs to be adjusted? When a patient does or doesn't do something that was agreed on, get curious. What is the barrier? Do they have all the information they need to make an informed decision? Are they in need of any additional support? Do we need to revise the plan? We're so lucky in renal services to have multidisciplinary teams working together to support patients. This means that none of us have to be doing this work alone. Collaborative goal setting takes time and best happens over multiple conversations, ideally beginning before any significant decisions need to be made. Trust the process. Get to know your patients as the unique and capable individuals that they are. In my experience, when patients are included in the conversation from the very beginning and kept in the loop with the information they need to make informed choices, then they are better able to adapt to and navigate planned and unplanned changes to their situation. And all of this really does make our jobs easier. Patients will have their own reasons for what they decide, and we can better support their journey when we understand what matters to them. Thank you.
I'd like to thank our amazing panel of speakers, and we actually do have a few moments for questions. So if anybody wants to raise their hand or ask anything of our panelists here today.
Two of you have mentioned documentation, and I'm just wondering about how you've solved it, or if you've solved it at Coastal. And for Janice, if there is going to be communication between the renal unit and inpatient care.
So I don't think we've solved it in a nutshell. I think we are trying to document as much as possible in a place where other people will see things, because our patients are so highly likely to be healthcare system users. So we tried to put the meat of it into Cerner, which is what we're using now, but recognizing that we do want certain parameters to be also indicated in promise. We do our best to try to get it in there. So the intentions are good. It's just that it takes time, and so I think it just increases the chance that you'll miss one or another. So we haven't got that. We haven't got that one beat yet. Ideally, they communicate.
Thank you. I think we might have.
We really are just trying our very best to. For us, we're just trying our very best right now to document, to let the rest of the department know, in terms of the fact that our patients are with us all the time. So they're with us 3 or 4 times a week. So hoping that the rest of the department knows. We're in transition of paper documentation to Cerner, similar to what Vancouver Coastal has. So our hope is that with better documentation on our care plans, it'll eventually become completely electronic, so then the inpatient units will be able to see it as well. So we haven't solved it yet. We're just working on it.
I'm grateful to everyone who's blazing trails with Cerner, so it's perfect by the time it rolls over to us. I think we have time for one more question. We've got exactly 60 seconds. Yeah, right here.
Maybe this is for Helen, but is there any shorter term metrics that we can be kind of in our documentation seeing if we're improving our frequency of goal setting with patients?
Yes, we do have some of the process measure in place with the ESAS uptake and also advanced care planning documentation in promise. So those metrics are being generated every 6 months. So you can look at it as surrogate of whether or not those conversations had the opportunity to initiate in that way. And in follow up to the previous questions too, there are work behind the scenes that are happening between Promise and the different Cerner team to make sure that perhaps in the future there are ways to minimize those duplicate data entry that are happening. So we are well aware of it.
Great. Well, one more round of applause for this awesome group.